And welcome back. Well, if you leak when you jump, you dance, you sneeze, or even laugh, the cause is likely stress urinary incontinence, called SUI. Deborah Merrick is back from Zelko Aesthetics to chat about a way to treat SUI. It's called VIVEVE.
VIVEVE. Yep.
VIVEVE. I was
VIVEVE.
close.
You're
Welcome
close.
back, Deborah.
Thank
Good to
you.
see you.
You too.
Okay, this is, I think, an interesting topic because as girlfriends, a lot of us talk about it or joke about it with each other, but it's not something that oftentimes is brought to a doctor or to an aesthetic center. So it's an interesting topic that I think people are willing to talk about. How did this become an interesting topic for you guys?
Well, Dr. Zelko was an OBGYN before he did cosmetic surgery.
Yeah.
So he's always been passionate about women and, you know, making sure that they're whole in body, mind, and in spirit. And so this was a natural progression for us as well. About a year and a half ago, we got the system, and we have been having amazing results and trying to normalize this topic
Well, that's
for women.
the thing. The conversation can be had. It doesn't need to be embarrassing because it's so common, and it's a place that you can come and feel confidential and have a free consultation as well.
Right.
So let's talk about what VIVEVE, is that right?
Correct.
VIVEVE is. This is a device.
It is a device. It's a treatment that we use. It's a probe that's inserted into the vaginal canal. It creates a radio frequency pulse, and we are the only ones that have cryogen cooling with it. So the actual tip has thermometers, so it can make sure that there's no damage to the tissue. And the biggest thing about the cryogen cooling is that it's time on tissue that's so important, sustained time on tissue that allows us to generate pulse into the very deep tissue where, again, stimulating collagen.
So what happens? Because we say SUI, stress urinary incontinence. What has happened?
What's happened is the collagen in the vaginal canal is become lax. Just like when you get face fillers in your face and things like that. So it doesn't support the urethra. So when we build collagen, we build and support the urethra. And therefore, that stops the stress urinary incontinence. And it also, VIVEVE also has a sexual function apparatus part of it. So what it does is when it's stimulating collagen, it's also helping with lubrication issues and laxity issues.
Because that's another big problem, you know, for a lot of women that they don't want to talk about is sex. Sex may be painful or uncomfortable, and it doesn't need to be. There's solutions for it. So some of the benefits that you mentioned, again, just kind of go over them. So this treatment can benefit you, again, in which ways?
With stress urinary incontinence, so women that are leaking urine when they run, jump, cough, sneeze, they're always running to the gym, they're having to wear sanitary pads every day, so that will stop that. It will also increase lubrication, so decrease pain and intercourse, and then it'll also, it's laxity issues, so it makes the vaginal canal smaller for women that are having sexual function issues.
So tightens it up.
Tightens it up.
Tightens it all up, makes you more youthful.
And we combine that with a device called Attain, which is a take-home device. So that's the device too that is a maintenance and can stop different kinds of stress urinary incontinence that VIVEVE can't. So we have a guarantee, which is really nice, that your symptoms will subside.
I've never heard that before, that you have a guarantee that your symptoms will subside. How long before that happens?
Well, you have a treatment, and in about 30 days to 60 days is when your collagen starts to build. So that's when you should start noticing some very dramatic decrease in your stress urinary incontinence. Same thing, increase in the lubrication. And studies for VIVEVE go out at a year. So at a year, 91% are still ecstatic with the results.
Wow.
So if you have the Attain device, you can use it as a maintenance device.
So I think people are going to want to say, who's a good candidate? Can you be any age for this?
You can be any age. The one thing that is most things, pregnancy, with you're getting a radio frequency pulse, you can have a pacemaker or any electrical charged devices. And women that have had cancer treatments within the last 6 months. Or a significant prolapse. But those are things that we'll go over in a consultation, making sure that everyone's a great candidate.
Is there any downtime to the procedure?
There's amazingly no. Like, you would leave the appointment and you'd never know you had it done. So there's no pain, no cutting, no anesthesia, no downtime. It is virtually pain-free.
Okay. I think this is the deal. People got to come in because there's a free consultation. You can tell Deborah's very open and comfortable to talk with. Again, it's VIVEVE. There's an offer right now for $500 off. Normally, this is a $3,000 treatment. Right now only, it's going to be $2,500. There's free consultations. They'll work with you at 414-520-3779. Again, you don't need to remember the name. Just go on in, make a free consultation, and you can chat about all the issues that you're having, and they will help you out. Thank you so much.
Thank you for having us.
I love that you chatted about this today. Appreciate it.
Helping women.